It's Tuesday, November 12th, and this is the Daily Medical News, where we bring you clinical medicine's top headlines, as well as a closer look at today's biggest story. I'm Molly Collegio.
And I'm Nick Andrews. Today, getting high could heighten the risk of stroke and arrhythmia.
Patients on TNF inhibitors can safely receive the Zostavax shingles vaccine.
Daily aspirin could cut the risk of fibrosis in non-alcoholic fatty liver disease.
And Medicare beneficiaries with Alzheimer's disease bear the heaviest financial burden.
Plus, the CDC identifies a prime suspect behind the spread of vaping lung injuries. Before we get to the news, we'd like to thank those of you who have taken the time to make this podcast better by taking our short listener survey. For those of you that haven't, we would invite you to take a moment to complete that survey. You can find a link to the survey in the show notes. And now, the top stories in clinical medicine.
Young, frequent marijuana users who also smoke cigarettes are at a nearly threefold increased risk for stroke. And people with cannabis use disorder are at a 50% greater risk of being hospitalized for arrhythmias. That's according to new research to be presented at the upcoming American Heart Association Scientific Sessions 2019. Researchers at George Mason University in Fairfax, Virginia, analyzed data on nearly 44,000 survey participants. Among the nearly 14% who reported using marijuana within the last 30 days, the odds ratio for young-onset stroke was 2.75 compared with non-users. In a separate study, researchers at Griffin Memorial Hospital in Norman, Oklahoma, found that people diagnosed with cannabis use disorder were up to 52% more likely to be hospitalized for an arrhythmia. Given the findings, the researchers recommend asking about cannabis usage in patients who present with symptomatic arrhythmia.
Patients on a tumor necrosis factor inhibitor safely receive the live attenuated varicella vaccine, Zostavax, without any cases of herpes zoster in the first 6 weeks after vaccination. The CDC's Advisory Committee on Immunization Practices says there's a theoretical concern that patients taking TNF inhibitors and other biologic therapies who receive a live attenuated varicella vaccine could become infected with varicella from the vaccine. And patients with rheumatoid arthritis and psoriatic arthritis who are likely to receive TNF inhibitor therapy are also at risk for herpes zoster reactivation. But the randomized controlled VERVE trial may ease those fears. Researchers at the University of Alabama, Birmingham included 627 people aged at least 50 years who were taking a TNF inhibitor and who had not previously received Zostavax. They presented their findings at the annual meeting of the American College of Rheumatology. At 6 weeks, there was no confirmed varicella infections among the 317 vaccinated patients, and there was no difference in the rate of disease flares or in adverse reactions between groups, though the varicella group did see a higher rate of injection site reactions than the placebo group.
Taking daily aspirin may help keep non-alcoholic fatty liver disease from progressing to liver fibrosis and non-alcoholic steatohepatitis. Researchers from Massachusetts General Hospital in Boston studied 361 adults with biopsy-confirmed NAFLD. 151 patients were on daily aspirin, usually to reduce cardiovascular disease risk. After a median of more than 7 years of follow-up, daily aspirin use was linked with a 32% lower risk of NASH and a 46% lower risk of fibrosis. Aspirin was the only non-steroidal anti-inflammatory drug that delivered such a protective effect. The researchers say that may be in part because non-aspirin NSAIDs disrupt the intestinal barrier, increasing delivery of pro-inflammatory cytokines to the liver. The link between aspirin and decreased fibrosis progression risk seemed to depend on duration of use. The greatest benefit came with 4 years or more of aspirin use. The findings appear in the journal Clinical Gastroenterology and Hepatology. We'll be back after this message with more medical news.
Welcome back to the Daily Medical News. I am Nick Andrews. The average out-of-pocket costs for Medicare beneficiaries with Alzheimer's disease were more than 2.7 times higher than the enrollees overall in 2016. That's the key finding from a new Kaiser Family Foundation report. Out-of-pocket spending for Alzheimer's disease or other dementia was higher than any other chronic condition, averaging nearly $15,000 in 2016. In contrast, average out-of-pocket spending for all beneficiaries in traditional Medicare was roughly two-thirds less than that sum, at about $5,500. The average cost for Alzheimer's-related services was more than $13,000. That was almost twice as high as the next most expensive condition, Parkinson's disease, and it was more than 4 times greater the overall Medicare coverage. The researchers say out-of-pocket costs are higher for Medicare patients with Alzheimer's disease because those beneficiaries are more likely to be in a long-term care facility. The researchers add that traditional Medicare's lack of an annual out-of-pocket limit may undermine the financial security that Medicare gives to its beneficiaries.
There's a possible breakthrough in the hunt for the cause of a nationwide outbreak of vaping-related lung injuries. The potential culprit? Vitamin E acetate. The injuries have an official name: e-cigarette or vaping product use associated lung injuries, also known as EVALI. The CDC says it's received 29 samples of lung fluid from EVALI's patients in 10 states, and vitamin E acetate was identified in all samples. Vitamin E acetate has already been found in some vaping devices. The discovery of the chemical in patients' lungs increases the likelihood that the toxin is at least one source of EVALI. The findings are the first to link substances found in vaping products with biological samples from patients hospitalized with EVALI. As of a week ago, there have been 2,051 cases of EVALI reported to the CDC, and 39 EVALI patients have died. Other deaths are still under investigation as possibly related to EVALI. CDC officials say the trend in new EVALI cases reported appears to be decreasing, but some states continue to see new cases. They caution that the lab findings of vitamin E acetate don't rule out the other possible compounds that may contribute to EVALI. The investigators also found THC in 23 of 28 samples tested, while nicotine was found in 16 of 26 samples tested. And that's it for today's Daily Medical News. If you like what you hear on the Daily Medical News, please leave us a review or rating on Apple Podcasts. For MD Edge, I'm Molly Collegio.
And I'm Nick Andrews. Thanks for listening to the Daily Medical News.